Hello, everyone. My name is Wendy Milak, and I am the CEO of ABC Medical. We are here today to discuss the new electronic health record system. Do you know what an electronic health record system is? Good answer. For those of you who don't know, an electronic health record system is a systemized collection of patient health information that is electronically stored in digital format. Can we share this information? These records can be shared across different healthcare settings. There are many functions that come with this system that are beneficial for your clinic and your patients. Some of the functions are easier access to your patient information. We can track electronic messages to staff, other clinics, hospitals, and labs. We are also able to order lab tests and diagnostic images, and we are linked to the public health system. We maintain patient records, which include managing patients' demographics, problem lists, medication lists, and patient history. We manage clinical documentations and notes, as well as capture external documents. We present care plans, guidelines, and protocols, and we also manage the care plans and guidelines and protocols. And lastly, we generate and record patient-specific instructions. Now, I've just named off a few. There are many more that are involved. But let's talk about the advantages. Provides accurate, up-to-date, and complete patient information. It enables quick access to your patient's records for a more coordinated and efficient care. You can securely share electronic information with your patient and other doctors. It helps providers more efficiently diagnose their patients, reduces medical errors, and provides a safer care environment. It also improves patient and provider interaction and communication, as well as a healthy care convenience. It enables a safer and more reliable way to prescribe medication. It helps promote legible, complete documentation, accurate and streamlined coding and billing. Enhances privacy and security for your patient's data. Helps providers improve productivity and work-life balance. It also provides improvement on the efficiency and meets their business goal. But lastly, and most importantly, it reduces costs through decreased paperwork, improves safety, reduces duplication of testing, which improves your patient's health. But like always, when there's advantages, there are disadvantages. For example, some clinics say that electronic health records are cost efficient. Other clinics don't like them and they don't agree. So some of the disadvantages are financial issues, including adoption and implementation of this system, ongoing maintenance costs. It presents a disincentive for hospitals and physicians to adopt and implement the electronic health record system. It also changes the workflow for the medical staff and the provider, which gives temporary loss of productivity, which stems from end users learning the new system, which may potentially be a loss of revenue. Loss of revenue is from the electronic health records being associated with fewer redundancies, fewer errors, and shorter lengths of stay at the clinic. It is conceivable that a given provider may avert certain billable transactions. I know the disadvantages sound bad, but I know, in time, we will get ahead of this backlash, and it will be better that we have adopted this system. But let's talk about peripheral technology. Do you know what peripheral technology is? Anyone? Raise your hand. Don't be shy. Peripheral technology is any external device that provides input and output for the computer. For example, your keyboard and your mouse. Those are input peripherals. Your monitor and your printer are output peripherals. And then you have your external hard drive that are both your input and your output peripherals. But mashing up all these functions, charting, clinical ordering, billing and compliance, improving quality, inside all this little system can be disastrous. Why, you ask? For the clinical user, more often it would be the physician and the nurses themselves. Every day they're using the system, clicky-clacking on the computer, the keyboards, the mouses. It can get quite exhausting. In large part, it is the billing and the compliance that are more dominant. So the question, can the electronic health record system be fixed by eliminating typing and clicking? And two men have answered. Robert Wachter, MD, and healthcare futurist Jeff Goldsmith make a case for addressing physician burnout. And it's not just the physician, it's the nurses and the MAs that also have to deal with the electronic health records, the office up front, who are making the appointments and checking in your clients, are also burned out. They have found that clinicians are spending almost half their professional time typing, clicking, and checking boxes in the electronic healthcare system. If the physician is spending half his time doing all of that, what do you think the nurses are doing in the front office? when they spend more time with the patient. Yeah, it gets tiring and very exhausting. So instead, Wachter and Goldsmith favor voice and gesture-based interfaces, noting that using a keyboard and a mouse are not only clunky, they do take up a lot of room, but they are also unsanitary. And for being in a clinic, we are supposed to be a sterile environment. So, we here at ABC Medical have decided to implement the voice and gesture interfaces. We are getting rid of the keyboards and the mouses. Speech recognition not only is more sanitary, but it saves us money in terms of transaction costs. It can also improve efficiency within our practice, and it also increases the quality of patient care that we provide. And I can't think of anything better than to help our patients. So now that you know a little more about the electronic healthcare system, if you have any questions, you can leave it down in the comments below. And until next time, let's keep learning. Let's keep moving forward. You have a good day.